In this video, we're gonna have a tutorial on how to locate and how to scan the appendix with ultrasound. You always need to begin the exam by confirming the patient's name and also date of birth, just to make sure that you have the right patient. And you also need to have the machine in the correct preset under either abdomen or appendix. And you need to use a linear probe when you are scanning the appendix. Before looking for the appendix, we always need to check for free fluid in the right upper quadrant and also the pelvis. As you can see in this slide, the location of the appendix can be variable. And the best way to start locating the appendix is to use the McBurney points, which is 1/3 the distance between the umbilicus and the iliac spine. And the location of the appendix is most commonly retrocecal, but it can also be seen subcecal, subhepatic, and in the pelvic, as you can see in these images in these slides. In this slide, you can see images in different planes of appendix, and they are all showing a normal appendix. As you can see in sagittal, it looks like a blind-ended tubular structure extending off the cecum, and it is located in the right iliac fossa region, and it is easily compressible. The AP diameter will be less than 7 millimeters, and there will be little or no color flow with Doppler. As you can see in this video, the sonographer is using compressions with the transducer to help displace small bowel loops out of the way. And the displacement should allow the visualization of the iliac vessels in the right iliac fossa as well as the psoas muscle. Compression will also help determine if appendicitis is present or not. As you see in this video, this patient is experiencing right lower quadrant pain, and she recalls in pain at McBurney's point, which is called rebound tenderness. When a patient presents with right lower quadrant pain, it may be suggestive of acute appendicitis, and the sonographer should ask where the patient feels the pain and start scanning at that location. And inflamed appendix can be seen on 90% of the time. The patient will also have an elevated white blood cell count, fever, nausea, and vomiting. You can see in this slide that the inflamed appendix will appear as a target lesion in the right lower quadrant, and the size in diameter usually exceeds 7 millimeters, and there will be increased blood flow on a non-compressible structure without peristalsis. And the blind end of the appendix is easily visualized. In this clip, you can see an inflamed appendix in a transverse view, and you can notice the thickened walls and non-compressibility. This is a sagittal sweep of an inflamed appendix showing signs of inflammation. Sometimes an appendicolite with shadowing may be seen within the lumen of the inflamed appendix, as you can see in these images. And this finding is always indicative of appendicitis, regardless of the presence or absence of other symptoms.